Hello, everybody, and thank you for joining us and allowing me to talk about the great vessel program, the Aortic Center that we have here at Cleveland Clinic and our experience over the last year. Again, looking back through the data for 2024, we've increased the aortic volume sent at the center here, and that's not just in the any one particular part of the aorta, but the entire aorta as a whole, joining with our colleagues in vascular surgery. And we use an array of different strategies to repair the aorta and replace the aorta, from endovascular, minimally invasive, conventional open, and a hybrid of all of them combined. We're up to 1,650 cases last year. And if you look just at the thoracic aorta in the chest, that was over 1,300 operations, and the majority of them elective, but still with 17% of our operations being emergent and a higher risk in nature. Looking at our outcomes from all these operations, we observed a 0.8% mortality with these high volume complex operations. And that's much less than the expected 2.5% that you would ordinarily see with these kinds of operations. In 2024, we did 771 root replacements. That includes 467 Bentols, where we replaced the root and the valve, 64 homografts using donated human tissue to replace the aortic root and the valve, oftentimes for very complicated endocarditis or complex redo situations. 210 valve-sparing root replacements and valve reimplantations, and 30 Ross operations, harvesting the pulmonary autograft and moving into the aortic position. Our mortality for these 771 operations is 0.8% in the elective situations and 5.7% in the emergency situations. And I think the majority of these emergency operations were type A dissections or very, very ill patients with an expected very high mortality. When we looked at our data going out, elective root replacements, aortic valve reimplantation, 2.5%, so very low. Looking especially at the aortic valve reimplantation and saving the living human valve, this volume's increased year over year, and in 2024 we did over 200 operations where we reimplanted the aortic valve into a synthetic aortic root, treating aneurysmal disease and often valve regurgitation. And we do it very well. When we looked at our data, we're at 90% from freedom from reoperation at 12 years. So these are durable repairs. We continue to do many, many arch operations, and these are often quite extensive, illustrated by the elephant trunk procedure, where we replace the entire arch and also leave a graft down in the descending aorta for later stage procedures. Last year we did 132, consistent with the last year's volume as well. But the way we're doing these continue to evolve. So update from our Be Safer study, where it's a physician-sponsored study led by our own Dr. Roselli, innovating a new way to replace the aorta more extensively with excellent results. We're up to 421 patients and counting enrolled in this study in just a few years. 45% of these patients, nearly half of these patients, were acute type A dissections, and the overall mortality for this entire group, which is very high risk, is 5%. In addition, we're continuing to advance new devices and hybrid solutions in these patients. The AMDS was just finished its trial we participated in, and now we have it available for us to use as well in dissections, oftentimes acute. Dr. Koprivanic has used them recently, as a week ago. We also have a growing experience with these branch stented angiografts. So this is an entirely endovascular repair of an aortic arch aneurysm and descending aortic aneurysm. And we are publishing our data which is among the most that's been used since it's become commercially available. And the data was presented at the European meeting, EX. Additionally, we're participating in the ARISE-2 trial using ascending stent grafting for chronic ascending pathology. And we are currently the highest enrolling site of this multi-site trial. And there's already talks to begin the next phase of it, the ARISE-3 trial for acute type A dissections. And you see here a completely treated endovascular repair of the ascending, descending arch thoracic aorta there in the computer, in the 3D reconstituted imaging there. And that's the stent right there, the ascending stent graft. That is what these trials investigating. But we have other trials going along the way as well. We participated in the Duet vascular graft anastomosis trial, and they've submitted some of their results, and we'll see if we'll continue with that. And there's new trials coming online, such as the Artisan trial to trial the Arcevo device to, again, improve the way we replace arches in thoracic aortic disease. The hard work of everybody in the Aortic Center was recognized this year at the Marfan Foundation, and the aortic directors were able to receive an award presented there. We continue to fundraise and to advocate for aortic diseases with the Marfan's Walk, and raised over $50,000 this last year with over 350 participants. We continue to try and share what we know and educate our colleagues and partners to improve cardiovascular care and aortic care by hosting root courses. And this year we'll again host our biennial aortic disease conference, CLE, Comprehensive Lifelong Expeditious Care, here at the Cleveland Clinic in the Aortic Awareness Disease Week in September. Thank you.